Thank you for coming. I think it's important to make clear right off the bat that even if Congress and the incoming administration were to do nothing, absolutely nothing, amending or repealing parts of the Affordable Care Act, the law is not working.
Right.
It's collapsing. The prices are unaffordable, markets nearly non-existent, few options to several states and counties. This year, 1 out of every 3 counties in this country only has one insurer offering coverage on the exchange. What tools do you have or will you have when you're confirmed, which could be utilized over the next couple of months to provide stability and improve the individual insurance markets, make them more appealing so that insurance carriers will want to come back and provide more coverage options as we transition away from the Affordable Health Care Act?
Well, thank you, Senator. I think it's incredibly important for us to admit here what the American people know, and that is that this law isn't working. Certainly isn't working for folks in the individual and small group market. You got premiums that are up significantly. They were supposed to go down by $2,500. Now they're up more than $2,500 on average. You've got deductibles that have escalated to $6,000 to $12,000. You've got, as you mentioned, states where there's only one provider, insurance provider carrier. You've got 1/3 of the counties in this country where there's only one insurance carrier. This is maybe working for government, maybe working for insurance companies, but it's not working for patients. And so what we need to do is an effort to try to reconstitute the individual and small group market. And that begins, I believe, by providing stability in our conversation and in our tone. And one of the goals that I have is to lower the temperature in this debate, is to say to those providing the insurance products across this country, we understand, we hear the challenges that you have. They're already exiting the market. What we need to do is to say there's help on the way to allow us to reconstitute the individual and small group market that allows for folks to gain the kind of coverage that they want for themselves and for their family, not that the government forces them to buy, that allows them to purchase coverage at a reasonable amount, that makes it so that they don't have deductibles that are out of the through the roof, where they don't have the ability to pay the premiums and the deductible as well. So there's so many things that we ought to be focusing on to make certain, again, that the American people have access to the highest quality care that's affordable for them.
Doctor, I have 84 critical access hospitals in my state. It's all part of the rural health care delivery system, which is under great stress. As we have seen when I visit with hospital administrators all throughout Kansas, there was a time I knew every one of them, but they're scratching their heads over regulations coming out of HHS, CMS. It used to be HEW and HCFA, and the story goes on, and all the other agencies that you will oversee when you are confirmed. I mentioned the Meaningful Use Program for electronic health care records. Doctors used to spend, what, 10 to 15 minutes with patients. It's now down to about 2 or 3, and then they have to report immediately on what was going on. The 96-hour rule for critical access hospitals, numerous other documentation requirements. Seems to me there's a lack of understanding of our provider shortages in our rural areas. We're just hanging on by a thread, and how these one-size regulations from Washington simply do not translate to rural Kansas or any other rural area with sparse population. My question is, how will you work to ensure an effective but smarter, less burdensome rulemaking process?
Well, this is really critical, Senator, because as you mentioned, in the rural areas, Georgia is the largest state geographically east of the Mississippi, and we've got a large rural population, and critical access hospitals are so important to communities around our state and truly around this nation. But the regulatory scheme that's been put in place is choking the individuals that are actually trying to provide the care, so much so that you've got physicians and other providers who are leaving the practice, who are leaving the care of caring for patients, not because they've forgotten how to do it or they've grown tired of it, but because the onerous nature of the regulatory scheme coming out of Washington, D.C. The Meaningful Use project that you mentioned makes it that much more difficult. We've turned physicians into data entry clerks, and all. You just have to ask them what they're doing. And if you talk to patients, what they recognize is that when they go in to see their doctor, they see the top of his or her head as they're punching the information, the data into a computer, as opposed to that sharing of information that's so vital and necessary between the physician and the patient.